I'm Dr. Justin Nelms, Chief of Vascular Surgery at Baltimore Washington Medical Center. Today we're here in our hybrid operating room featuring the Siemens Pheno fixed imaging unit. At Baltimore Washington Medical Center, we treat a variety of vascular diseases, from peripheral arterial disease to aneurysmal disease to cerebrovascular disease. Traditionally, a lot of these surgeries have been done with an open technique requiring large incisions, a great deal of soft tissue damage, and significant patient discomfort and morbidity. The evolution of vascular surgery has been to progress toward minimally invasive approaches, and many of these conditions can be treated in this manner. The Siemens Pheno device is a robot that employs cutting-edge technology to allow us exceptional imaging when performing these procedures. A patient receiving an endovascular procedure would come into the operating room and be positioned on this table. We're then able to use the device to gain whatever angles we need or positioning that is required to perform these effectively. As the patient's on the table, the device will take X-rays that then appear up on the monitors. This allows us to perform these procedures with excellent precision and accuracy, resulting in safer patient outcomes. The robot will also allow us to execute these procedures with lower radiation dose and lower IV contrast use. The robot's incredible imaging quality and versatility allow us to expand the scope of endovascular procedures we're able to offer patients. At the University of Maryland, Baltimore Washington Medical Center, the vascular team is excited to bring this cutting-edge technology to the community and help continue to provide excellent outcomes for patients with vascular disease.